You may have noticed talk of another virus outbreak in parts of Europe, Australia, and right here in the United States. It's monkeypox, a rare viral disease that's in the same family as smallpox. The virus typically starts with flu-like symptoms, and patients may develop a rash that looks similar to chickenpox. What's also causing concern is another distinguishing feature of the virus, these scary fluid-filled blisters that may appear on the hands of folks and other parts of the body as well. At least 85 cases of monkeypox have been reported in 10 countries, so how worried should we be about it, posing a serious health risk to the public? Joining me now is actually an expert on monkeypox, I learned this week, because the virus became something we were talking about. Dr. Anne Rimoin, she's an epidemiologist at UCLA. So what's monkeypox? Tell us more. What is known about monkeypox in terms of the history of the virus, and how is it spread?
Well, Zerlina, thanks for having me. And yeah, before I started working on COVID, I was working on monkeypox. I've been working on monkeypox in the Democratic Republic of Congo for 20 years. So monkeypox is a pox virus. It's a cousin of smallpox, which was one of the most terrible infectious diseases known to man. And one of the greatest achievements in history was the eradication of smallpox. Once smallpox was eradicated, all of a sudden it left the door open for other viruses to fill that niche that were related, because we no longer had disease circulating and we no longer had vaccine. We were no longer vaccinating people to protect against it. Monkeypox is less severe than smallpox. There are two main forms of it. One is the Central African clade, which circulates in places like DRC, where I work, and then the West African clade, which is milder, circulates in West Africa, and is associated with the current outbreaks that we're seeing.
Okay, so how worried should we be then?
Well, I think this is not a cause for mass concern. This is an important virus. It's important that we're identifying these cases. It's important that we follow the data and that we understand the scope of this kind of widespread disease that we're seeing very unexpectedly, and that we learn more before we get exceedingly worried. This is not transmissible as we know it in the same way that something like COVID is. It requires, as we know, monkeypox, closer, more prolonged contact, and is a very different kind of virus. So something to be thinking about if you've had a rash or travel, and something that you might be a little bit concerned about, you can certainly reach out to your doctor. But I would say that this is not something that the general public should be concerned about at this point.
And as you said, there's a visible symptom, right? So unlike COVID, the rash is an indication that you need to call your doctor or isolate, or both. In terms of this particular moment, I mean, one of the jokes I've sort of had the whole pandemic is that if COVID gave you blisters or face lesions or some sort of outward symptom that, in our vain society, people care very much about, I feel like more people would have complied with mask mandates and stayed at home if COVID looked like these photographs of monkeypox. But in terms of just the public's willingness to, one, not freak out, but also listen to the advice of folks like you, I mean, how should we be thinking about monkeypox as compared to COVID? Because we're surging right now in COVID cases.
Well, what I would say is, in the things that people need to worry about, if the general public should be concerned about COVID right now, because we are, as you mentioned, we're in a surge. We are seeing very large numbers of cases that are being reported, and that's in addition to the cases that we know are not being reported because people are testing at home, and hospitalizations are starting to creep up again. What we're seeing with monkeypox are isolated clusters of cases that are likely associated with either travel to West Africa or maybe in clusters of gay men who have sex with men, bisexual men that may have had contact, and we're trying to understand what may have driven this. But we're not seeing thousands of cases here. We're seeing clusters of cases that need to be investigated. We need more information. We'll at that point be able to say more about it.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.